Welcome. This is an overview, a general overview of some information about the other dementias. Call it the other dementias because most of us are familiar, or at least have some understanding of what Alzheimer's disease is. But there are several disorders or diagnoses that cause dementia. Dementia is a wide-stretching symptom over over many different diagnoses. And so I think it's important to learn a little bit about them. Again, most of us are familiar with Alzheimer's, so I won't spend a lot of time talking about that today, but there are some other common dementias that I want to talk about today, just at least give you guys a starting point. If this is, if you hear a diagnosis come up that you're experiencing with your loved one, hopefully I can give you a little bit of information about that diagnosis that you don't already have. But again, this is a generalization of the diagnoses, general information about symptoms. And so everyone's specific case is going to be different. But this hopefully will give you a nice ground, or lay some groundwork for your own research and your own conversations with your medical providers. So just a quick little disclaimer here. This training is for informational purposes only and should not be used to diagnose or treat any illness. Always consult your doctor for case-specific questions and treatment options. Okay, I'm not a doctor, so I cannot give you specifics about your case. The information provided here is generalized and does not replace care under a licensed medical professional. Majority of the information I'm going to share with you today can be found on the Alzheimer's.org website. It's pretty up to date. It's a really great space to go if you haven't yet visited to get specific information about diagnoses and local links to local physicians, things like that, more information that you can definitely go on there and click around. I found it very fascinating, the information that I found, and very helpful. And so that's where most of my information has come from. Not my own personal experience as a medical professional, because again, I am not one. So the agenda today is we're going to define dementia. What is dementia? We're going to go on a quick tour of the brain, try to understand how different parts of the brain affected by dementia are different diseases that cause dementia and how that works. We're going to talk briefly about Alzheimer's disease. Then we're going to talk about Lewy body disorder, frontotemporal dementia, vascular dementia, and mixed dementias. Besides Alzheimer's disease, Lewy body disorder, frontotemporal dementia, and vascular dementia are the most common causes of dementia. And so we're going to go over those. And let's go ahead and start with our definition here. So what is dementia? Dementia is the umbrella term for a number of neurological conditions, of which the major symptom includes a global decline of brain function. Dementia was a relatively rare occurrence before the 20th century, as fewer people lived to old age in pre-industrial society. It was not until the mid-1970s that dementia began to be described as we know it today. We know dementia is a disease symptom and not a normal part of aging. There are over 100 diseases that may cause dementia, okay? While the term Alzheimer's disease and dementia are often used interchangeably, it's important to know the difference between the two. So dementia is not one specific disease. It's an umbrella term for a set of symptoms caused by physical disorders affecting the brain. Alzheimer's disease is the most common cause for dementia, and it accounts for 60 to 80% of all diagnoses of dementia. Overall, know that Alzheimer's disease is a specific disease, while dementia is a general term for a group of similar diseases, of which Alzheimer's is one. So in other words, every case of Alzheimer's disease is an example of dementia, but not every type of dementia is Alzheimer's disease, okay? So even though we use those terms interchangeably, and in most cases it is applicable because again, Alzheimer's accounts for 60 to 80% of diagnoses of dementia. Not everyone who has dementia symptoms or is experiencing dementia has the diagnosis of Alzheimer's, okay? So quickly, we're going to talk about the brain. So the brain has three main parts. There's the cerebrum, the cerebellum, and the brain stem. And again, as I go through this training, I'm going to try very, very hard to pronounce a lot of these words properly. But again, since this is not my profession, I am a social worker and I curate this information for you. I may mispronounce some words, so please forgive me if I do. The cerebrum fills up most of our skull. It's involved in remembering, problem solving, thinking, and feeling, and it also controls movement. The cerebellum sits at the back of our head under the cerebrum, and it controls coordination and balance. And finally, the brain stem sits beneath our cerebrum in front of our cerebellum. It connects the brain to the spinal cord and controls automatic functions such as breathing, digestion, heart rate, and blood pressure. And these three parts of the brain, if they are affected by a dementia-causing disorder, it's going to show up in different symptomology. So if you have dementia symptoms associated with movement, you're probably going to have those protein deposits in the cerebellum. Okay, so you don't have to remember all this right now. This is just a brief overview so we can kind of start to understand what dementia is and how it affects our brains. Okay, next we talk about our supply lines. So our brain, it needs blood to survive, right? And a lot of times when we have a disease that causes dementia, those blood supplies are interrupted. So with each heartbeat, arteries carry about 20 to 25% of our blood to our brains, where billions of cells use about 20% of the oxygen and the fuel that your blood carries. The whole vessel network includes veins and capillaries in addition to arteries. Your brain is nourished by one of your body's richest networks of blood vessels. There's a lot of blood going into the brain. And so when we're thinking hard, we might even use up to 50% of fuel and oxygen that we take just by going into our brains. If you guys can remember back when you were in school and cramming for an exam or studying, you know, physically you weren't doing a whole lot, but mentally you were, but you're still feeling physically exhausted. It's because your brain is using up all that energy just to work, okay, when you're thinking hard. So briefly, we're going to define Alzheimer's. So Alzheimer's affects more than 5 million Americans. It's what most people think of when they hear the word dementia. So if someone that you know has Alzheimer's, you'll notice symptoms like memory loss and trouble planning and doing familiar tasks. Symptoms can be mild at first, but get worse over a number of years. So your loved one might be confused about where they are, what day or year it is, have problems speaking or writing, lose things to be unable to backtrack to find them. They may show poor judgment, and they may have mood and personality changes. Okay, so these are just some of the symptoms that statistically starts mild and then they increase over time. And just an interesting little note here, we got the name Alzheimer's disease because it was based after the German psychiatrist who first published a case of pre-senile dementia, which would later be identified as Alzheimer's disease. And his name was Alois Alzheimer, I think. I think that's how you pronounce it. And if you need a physical or a picture diagram here, because I'm a picture person, I learn with pictures. So here's a little thing about Alzheimer's disease. So if you look here, there are these things called amyloid plaques and tau tangles, okay? So they first develop in the areas of the brain concerned with memory and cognitive function. So abnormal deposits or proteins form throughout the brain. And this can cause mild symptoms like wandering and getting lost, repeating questions, moderate symptoms, problems recognizing friends and family, and impulsive behaviors, and severe symptoms like maybe they cannot communicate. It's typically diagnosed in the mid-60s or older, and some rare cases you can get early onset Alzheimer's between mid-30s to 60s, okay? So again, that's just a real quick refresher of Alzheimer's. And now we're going to get into some of the other dementias. We're going to start with Lewy bodies dementia. So Lewy bodies are named after, I'm going to say this wrong, Friedrich Heinrich Lewy, or F.H. Lewy, is a German doctor who first identified them. So Lewy body dementia occurs because of abnormal deposits of a protein called alpha-synuclein that develop inside the brain's nerve cells. And you'll notice this kind of common thread with all of these dementias. It really is about proteins developing little clumps and kind of blocking blood flow, blocking functioning into the nerve cells of the brain. And that's causing a lot of these symptoms. So with Lewy body dementia, they call those deposits Lewy bodies after the scientists who discovered them. And Lewy body dementia accounts for between 5 and 10% of all dementia cases. So it's not as prevalent as Alzheimer's, but it is still affecting a large portion of our population. These protein deposits, or Lewy bodies, typically affect the areas of the brain that involve thinking and movement. The built-up mass of Lewy bodies block messages between the brain cells, leading to dementia. Lewy bodies are also found in Parkinson's disease. So when Lewy bodies first appear in the part of the brain responsible for thinking, the term Lewy body dementia is used. But when they first appear in the part of the brain responsible for movement, the term Parkinson's disease dementia is used, okay? So Parkinson's and Lewy bodies dementia are both caused by abnormal deposits of the alpha-synuclein protein. It just depends on where they deposit. That's going to determine your diagnosis. So Lewy body dementia can also be referred to as dementia with Lewy bodies or Lewy bodies disease. So I do have another infographic for you. So if you see here, this little yellow dot is called a Lewy body, and it's snuggled into your neuron here, okay? And Lewy bodies will cause both Parkinson's disease and Lewy body dementia, okay? So if you've got, look right here, we've got a neuron. Dopamine is a chemical that neurons use to send messages to one another. So if you have two healthy neurons, they will communicate with dopamine well, right? The way they're supposed to. However, if your neuron has a Lewy body in there, it is blocking the dopamine from going to other neurons and communicating, and that can cause some of the neurons to die, okay? So if you have Lewy bodies in the basal ganglia or the midbrain, you will experience Parkinson's symptoms. So that shows up when Lewy bodies are found in the brainstem and movement control areas. Parkinson's is due to the death or loss of neurons that release dopamine. And you'll get symptoms like stiffness, tremors, poor coordination, difficulty walking. Dementia symptoms of Lewy bodies show up when they are found in the brain cortex and mood and memory centers. So if they're in the cerebral cortex, you might find out that, or you might see the symptoms of hallucinations and thinking and logic impairment. If they're in the amygdala, you'll notice mood changes. And if they show up in the hippocampus, there'll be impairment of memory, okay? So Parkinson's disease and Lewy bodies dementia are two separate diagnoses, but the main difference between the two is when the start of thinking and movement symptoms occur. So people with this condition might not have every symptom in the early stages of Lewy body dementia. And dementia with Lewy bodies is closely related to Parkinson's disease. People who have Parkinson's disease are more likely to go on to develop dementia, and this is known as Parkinson's disease dementia. Okay, so some people have Parkinson's disease and they do not develop dementia. However, there are some who do. Okay, they can both, Lewy body dementia and Parkinson's disease dementia can affect people in very similar ways. But if memory problems and dementia symptoms appear before or at the same time as movement problems and symptoms, then the diagnosis of Lewy bodies dementia is likely to be given. But if Parkinson's movement problems are experienced for a year or more before memory and thinking symptoms appear, the diagnosis of Parkinson's disease dementia is likely to be given. And it's not always easy to tell if a person has Lewy bodies dementia or Parkinson's disease dementia, as the timing of the onset of memory and thinking problems isn't always clear, okay? So Lewy body dementia is an umbrella term that includes both Lewy bodies dementia or disease and Parkinson's dementia disease. And so if you might have people use both interchangeably, and that's okay, because it's kind of useful to do that since they do share a lot of the same symptomology, okay? So what are the symptoms of Lewy bodies dementia? And these are not specific to Lewy body's dementia. They're very common in this diagnosis. However, you may see that your loved one who doesn't have Lewy bodies may also be exhibiting some of these symptoms simply because dementia symptoms are very similar across diagnoses, okay? So a progressive loss of memory, language, reasoning, and other higher cognitive functions, and likely the ability to calculate numbers. Difficulties with planning, organizing, and marked fluctuations in attention and alertness might be some of the first symptoms. Okay, so maybe they're misplacing things a lot of the times. Maybe they're not as alert or aware as they used to be. Maybe they were more easily distracted. Okay, the person might also experience changes in their vision and spatial perception in the early stages. Okay, difficulty with short-term memory, finding the right words to use, or maintaining a train of thought. They may experience depression and anxiety. There'll be changes in sleeping patterns, including a feeling of being tired during the day and alert throughout the night. Visual hallucinations and seeing things that are not real. And these hallucinations often include people, children, and animals who are not present. So a lot of times when we hear the word hallucinations, we automatically think of maybe somebody who has schizoaffective disorder or schizophrenia, where their hallucinations might be more terrifying. With Lewy body's dementia, it's typically not the case. It's usually, they see their grandchild, or they see their cat, or they see something kind of benign and not very threatening in the area that other people don't see. Next, there may be mistakes in perception of objects or textures. So an example would be seeing faces in a carpet pattern, which our brain does that normally anyways, but with Lewy body's dementia, it's a bit more pronounced. Motor symptoms of Parkinson's disease, which may include stiffness of muscles, tremors or shaking, stooped posture, or slow shuffling movements, and acting out one's dreams. This may occur years before the development of other symptoms. And in doing my research, it was often found that acting out the dream is the first symptom of Lewy body's dementia that people report experiencing. So how do you diagnose Lewy body's dementia? Well, there's really no single test to diagnose it. Doctors will typically diagnose it by eliminating other diseases and conditions that could cause similar symptoms. Common assessments can include a neurological exam, so they can figure out, they can assess the way a person walks, which is referred to as a gait analysis, and they can assess their posture and how rigid or stiff a person's body is. Other measures that they might use to assist in diagnosis could be obtaining a detailed medical history, brain imaging or an MRI, and physical and neuropsychological testing, okay? So it might be a very long process to get a diagnosis because, again, there are so many symptoms that mirror other disorders. It's really a process of elimination. So how do they treat dementia or Lewy bodies with dementia? So I'm going to hopefully say this right. Cholinesterase inhibitors are medications used to treat Alzheimer's disease, but they can improve alertness and cognition in some people with dementia and reduce hallucinations and other distressing symptoms. Behavioral therapeutic strategies also help people living with Lewy body's dementia. This can include using physical activity and music as treatments. Interestingly, research shows that the quality of life for people living with dementia and their caregivers is significantly improved by activities that use strengths and abilities. So zero in on what your loved one can do. What are their strengths? What are their abilities? Let's focus in on that, and that is probably going to be your best course of action when caring for somebody with Lewy body's dementia. By understanding a person's personality, their life experiences, support systems, and ways of coping, a person-centered approach to care can preserve and improve quality of life for a person living with Lewy body dementia. And I think this is great information to think about because when we're caring for somebody, it's very easy to focus on all they can't do and all the difficulties that revolve around that are involved in their care. But if we use a person-centered approach, focus on their strengths, focus on their personalities, it can make treatment a lot easier for everyone involved. So some caregiving tips for people with Lewy body's dementia. The first tip that I found was educating others about Lewy body's dementia. So informing the hospital staff of the diagnosis and medication sensitivities, and requesting that your loved one's neurologist be consulted before giving any drugs to control behavior problems. Sharing materials with the healthcare professionals who care for that person, and teaching family and friendlies about Lewy bodies dementia so they can better understand your situation, especially when you start getting into some of those more behavioral issues. If they understand that this is just the disease, it's not the person intentionally behaving in this way, it can make caregiving a lot easier. Preparing for emergencies. If someone who has Lewy bodies dementia, you want to make sure that you have a list of all their medications and dosages, list of their health conditions, including allergies to medicine or foods, copies of their health insurance card, copies of healthcare advance directives such as living will, and contact information for doctors, family members, and friends. Adjusting your expectations. You'll likely experience a wide range of emotions as you care for your loved one with LBD. So recognize your strengths and your limitations. Okay, that's very important. Adjusting your expectations can allow you to approach your new roles realistically and to seek help as needed. Okay, it's very important to know our limits. Okay, because if we can't do something, or if we can't do something well, we have to enlist the help of others. Okay, pushing through isn't always going to be the best solution. Understanding behavioral changes. So behavioral and mood problems in people with Lewy bodies dementia can arise from hallucinations, delusions, pain, illness, stress, or anxiety. It may also be the result of frustration, fear, or feeling overwhelmed. And this person may resist care or lash out verbally or physically. Hallucinations and delusions are among the biggest challenges for caregivers of people who have LBD. The person may not understand or accept that the hallucinations are not real and may become agitated or anxious. So a good tip would be, instead of arguing with somebody who is experiencing hallucinations, understand and accept, you can help by responding to the fears that they're expressing. So tuning into their emotions, you can offer empathy and concern, maintain the person's dignity, and limit further tension. Okay, so if you have, somebody at home with Lewy bodies dementia and they are seeing somebody or something that is not in the room with you, instead of saying, well, no, that's not there, try to, just give them, what's the word I'm looking for? Just kind of play along, I guess, right? You don't want to agitate them unnecessarily, okay? So if they say, well, there's a cat in the garage, like, oh, yeah, it's very pretty, or something like that, okay? It doesn't have to be an argument, because they don't know that you don't see that. And when you tell them you don't see it, it can be very distressful for them, okay? So if you can play along, that's a good caregiving tip. Next, addressing sleep issues. So increasing daytime exercise or activities and avoiding lengthy or frequent naps can promote better sleep. Avoid alcohol and caffeine or chocolate late in the day. Some over-the-counter medications can also affect sleep, so review all medications and supplements with your physician. Okay, we don't want to start just putting in a bunch of pills to treat the symptoms if you don't know what the reactions are going to be. You can also alter the home environment to try to minimize anxiety and stress for that person. In general, people with Lewy bodies dementia benefit from having simple tasks, consistent schedules, regular exercise, and adequate sleep. And just to note, large crowds or overly stimulating environments can increase confusion and anxiety. So if you can avoid bringing them into those spaces, it's probably best for both of you. Although I know that's not always the case. You can't always avoid, not taking someone to the grocery store, or not taking somebody to the doctors if it's very busy. But just keep that in mind. If you know you're about to go somewhere that can make them more agitated, just kind of, center yourself, prepare for that so that you're less likely to react and more likely to respond to the behavior. All right, next we're going to talk about frontotemporal dementia. So this is an umbrella term for a group of rarer disorders that primarily affect the frontal and temporal regions of the brain. And these areas are generally associated with personality and behavior. So the most common frontotemporal disorder is called BVFTD, which stands for the Behavioral Variant Frontotemporal Dementia. So that's a bit of a mouthful, but we're going to talk about that one because it is the most common one. Other names often used for frontotemporal dementia are semantic dementia, frontotemporal lobar degeneration, frontal lobe dementia, tau disease or taupathy, Pick's disease or Pick's complex. So if you're familiar with any of those other terms, this is what we're talking about. It's the frontotemporal dementia. Is also related to diseases that affect movement, such as atypical forms of Parkinsonism. In most cases, the cause of frontotemporal dementia is unknown. Now, if you have a family history of frontotemporal dementia, you're more likely to develop the disorder. So about 10 to 30% of behavioral variant frontotemporal dementia is due to specific genetic causes, okay? So it's formed by, it's caused by abnormal amounts or abnormal forms of tau and TDP43 proteins that accumulate inside neurons in the frontal and temporal lobes. Okay, so again, we're looking at proteins depositing where they're not supposed to deposit. So this can cause symptoms like behavioral and emotional symptoms, difficulty planning and organizing, impulsive behaviors, emotional flatness, or excessive emotions. So from one side of the spectrum to the other. They can have movement problems such as shaky hands, problems with balance and walking, and they may experience language problems, difficulty making or understanding speech. So again, there are several types of this disorder, and so symptoms can vary by type. These are just general symptoms, and the onset is usually between 45 and 64. So some of the symptoms, we're going to break them down into categories here. So we've got behavioral symptoms, executive dysfunction, and that is problems with planning and sequencing, prioritizing, multitasking, self-monitoring, and correcting behaviors. I'm going to butcher this word, I'm going to try it anyways. Perseveration is the tendency to repeat the same activity or to say the same words over and over, even when it no longer makes sense. My great-grandmother, she was diagnosed with dementia, but they never determined the disorder that was causing her dementia, but she would have episodes of perseveration, of repeating the same things over and over again. Social disinhibition, acting impulsively without considering how others perceive the behavior. For example, a person might hum at a business meeting or laugh at a funeral. Another symptom is compulsive eating, gorging on food, especially starchy food like bread and cookies, or taking food from other people's plates. Utilization behavior. So this is difficulty resisting impulses to use or touch objects that one can see and reach. So an example would be a person picking up a phone while walking past it when the phone's not ringing and they don't intend to place a call. Okay, it's just because it's within their reach, they're going to want to grab for it. Some language symptoms. We've got aphasia and dysarthria. So aphasia is the ability to use or understand words being impaired, but the physical ability to speak properly is normal. So an example from my life would be my grandfather on my mother's side. He experienced aphasia quite often, where he would call the remote control watch, or he would talk about his car and use various different words. So his ability to speak wasn't impaired, it was just using the wrong words. And then dysarthria is the physical ability to speak properly is impaired, like you're slurring, but the message is normal. So they're using the right words, they're just having a difficult time forming those words. Some emotional symptoms, we've got apathy, which is a lack of interest, drive, or initiative. It's often confused with depression, but people with apathy might not even be sad. They often have trouble starting activities, but can participate if others do the planning. Emotional changes, so you can maybe experience flat emotions, exaggerated emotions, or improper emotions. So they may seem completely disconnected from a situation, or emotions are expressed at the wrong times or in the wrong circumstances. So an example would be a person might laugh at sad news. Okay. Pseudobulbar effect is a condition of sudden, frequent outbursts of crying or laughing that cannot be controlled. This may occur, but it is treatable. And then social interpersonal changes. So this person may experience difficulty reading social signals, such as facial expressions and understanding personal relationships. And they may lack empathy, making them seem indifferent, uncaring, or selfish. Movement symptoms. We've got dystonia, which is abnormal postures of body parts, such as the hands or feet. A limb may be bent stiffly or not used when performing activities that are normally done with two hands. Gait disorder is abnormalities in walking, such as walking with a shuffle, sometimes falling frequently. They may experience tremors, which is shakiness, usually in the hands, but it can be in other parts of the body. An increase in clumsiness, dropping of small objects, or difficulty manipulating small items like buttons or screws. Apraxia is the loss of ability to make common motions, such as combing your hair or using a fork and knife despite normal strength. So things that they've been doing their whole lives, maybe they are finding a difficulty achieving those tasks. And neuromuscular weakness, so severe weakness, cramps, and rippling movements in the muscles. So a diagnosis of frontotemporal dementia is pretty difficult because the symptoms are very similar to other conditions. So an example would be sometimes it's diagnosed as a mood disorder, such as depression, and a person can have both frontotemporal dementia and another type of dementia, such as Alzheimer's disease. So because these disorders are rare, physicians may be unfamiliar with the signs and the symptoms, and so they may not even think to diagnose you with frontotemporal dementia. So if you think that maybe your loved one is experiencing frontotemporal dementia, and you talk with your doctor, they might do some diagnosis assessment that includes obviously perform an exam and asking about the symptoms. They'll look at your personal and family medical history. Remember, this could be an inherited trait. So if you have family members who have this diagnosis, it may be more likely that that diagnosis is for your loved one or for yourself. Using laboratory tests to help rule out other conditions. They may order genetic testing. They may assess memory, thinking, language skills, and physical functioning, and they might order an imaging of the brain. And sometimes a psychiatric evaluation can help you determine if it's depression or another mental health condition causing or contributing to the condition. But really only genetic tests in familial cases or a brain autopsy after a person has passed can confirm a diagnosis of FTD, okay? So if this is something you really want to push for, if you feel like these symptoms are, kind of textbook for what you're experiencing with your loved one, I would just recommend talking with your doctor and saying, how can we test for FTD? Because this might be what we're dealing with, okay? So treatments, there's really no cure for it, and there's no way to slow it down or prevent these diseases. However, there are ways to manage symptoms. So if you get this diagnosis, you may want to consider bringing on a team of specialists that include doctors, nurses, speech therapists, physical therapists, occupational therapists. Pretty much this team will be familiar with the disorder and can help you guide treatment. Medications are available to treat certain behavioral symptoms. So they found that antidepressants called selective serotonin reuptake inhibitors, or SSRIs, they're commonly prescribed to treat social disinhibition and impulsive behavior, which could definitely help you if you have a loved one that's difficult to take out into public because of their behavior symptoms. Perhaps there's a medication available to help kind of curb that behavior. Patients with aggression or delusions can sometimes take low doses of antipsychotic medications. The use of Alzheimer's disease medications to improve behavioral and cognitive symptoms in people with BVFTD and related disorders is being studied, although results so far have been mixed, with some medications making symptoms worse, okay? Which is why it's so important to know if your loved one is experiencing Alzheimer's or some of these other dementias, because Alzheimer's medications are not always going to work for everybody experiencing dementia. So if a particular medication isn't working, a doctor might try another, but always consult with a doctor before changing, adding, or stopping a drug, okay? Some caregiving tips. So trying to manage behavior changes in frontotemporal dementia, Recognizing that's the illness talking and accept it rather than challenging people with behavioral symptoms is going to go a long way for your sanity. Arguing or reasoning with the person won't help. They cannot control their behaviors or even see that they are unusual or upsetting to others. Now, I do know that knowing this doesn't make it go away. But sometimes it could be nice to remind ourselves, especially if our loved one is saying something kind of out of character or maybe a little, particularly vicious that day, just to kind of remind ourselves that this isn't mom talking, this isn't my loved one talking, this is the disease talking. Okay, and that can just maybe help you a little bit. Treating language problems. So to help with language issues, you can speak slowly and clearly, use simple sentences, wait for them to respond, and ask for clarification if you don't understand something. Again, remember, sometimes people are experiencing difficulty using the right words, even though they're trying really, really hard, or maybe they're slurring their speech. Just be patient with them, okay? Talk slowly, listen. Gesturing, drawing, and using an album with labeled photos of people and objects might help communicate without talking. Again, a speech or language pathologist can determine the best tools and strategy for each particular person, okay? Managing movement problems. So several types of frontal temporal dementia cause problems with movement, including difficulty balancing, walking, and swallowing. Medications, physical and occupational therapy, they might provide modest relief for the movement symptoms. And so a doctor who specializes in these disorders can guide treatment. Caring for someone with frontotemporal dementia can be very hard, both physically and emotionally, right? Preaching to the choir. And many caregivers will face decline in your own health. So here's some tips to keep you healthy. It may be just a refresher for some of you. So getting regular health care is important. You have to take care of yourself if you're going to take care of anybody else. So that means, recruiting friends and family that can help you, that are willing to help you to take care of other errands and tasks that you maybe are not able to get to. Spend time in doing enjoyable activities away from the demands of caregiving, which is why our respite program exists, so that you guys can get that time to recharge and fill your own cup, so to speak. Joining a support group is also very helpful. Sharing experiences and tips with other people, just feeling validated in your journey can go a long way for your mental health. But for many caregivers, there will come a point when they can no longer take care of their loved one with frontotemporal dementia without help. The caregiving demands are simply too great, and the person may need around-the-clock care, okay? The disease will progress, and caregivers may need home health care services, or you might need to look into a residential care facility, such as a group home, assisted living facility, or nursing home. Now, I do want to pause here because I know this is kind of a sensitive topic for a lot of caregivers that I have spoken to. I had one lady say that she felt like she was throwing mom away if she put her in a space that could care for her. And I heard some really good advice. I can't take credit, but it was a colleague of mine that said, if you have your loved one in a care facility, they have an entire staff of people taking care of them, right? They've got round-the-clock care, and they're employing a team of people to take over the duties that one person was doing, right? So when you're taking care of your loved one at home, you are doing a staff's worth of work for one person, or as one person, okay? So there will inevitably become a time where you cannot do that anymore. That workload is too much. And so if you are struggling with these decisions, if you're feeling guilty, please understand that it's not uncommon, okay? And there is nothing wrong with at least knowing what your options are. And by no means is increasing care for your loved one throwing them away, okay? We are all just singular individuals. We can only do what we can do. And I just want you to give yourself grace if you've hit a point that you can't do it anymore, okay? It's okay. Next, we're going to talk about vascular dementia. So this is the most common type of dementia after Alzheimer's disease. And this occurs when the brain's blood supply is blocked or damaged, causing brain cells to be deprived of oxygen and die. So if you remember the graphic from the very beginning of all those little neuron, or all those little networks of veins and arteries going into the brain, vascular dementia affects those and causes the starvation of the brain cells. So the network of blood vessels called the vascular system supplies the brain with oxygen, and this network allows the brain to function properly. If the vessels are blocked, diseased, or bleeding, blood is prevented from reaching the brain. With no oxygen and nutrients provided by the blood, the affected cells in the brain will die, and that is what leads to dementia. Researchers estimate that vascular dementia accounts for 15 to 25% of all dementia cases, okay? So different kinds of conditions affecting the brain's blood supply can lead to different types of vascular dementia. So we're going to talk about the two most common types, which are subcortical dementia and cerebral amyloid angiopathy or angiopathy. I'm not sure how to pronounce it, so forgive me. Subcortical dementia is caused by small vessels disease, where the vessels or small vessels in the brain become stiff and twisted, and that results in reduced blood flow to the brain. Cerebral amyloid angiopathy happens when a protein called amyloid builds up in the brain blood vessels. Amyloid can form plaques, disrupting brain function, and this also often occurs with Alzheimer's disease. So stroke is a common cause of vascular dementia. So if you don't know, a stroke occurs when the blood flow in an artery stops, either because it's blocked or because it bursts. Blockage or damage means the brain cells aren't receiving oxygen and nutrients, leading to brain cell death, and this may lead to vascular dementia. Having a stroke more than doubles the risk of developing dementia. Strokes can be large or small and can have a cumulative effect. So that means each stroke adding further to the problem. So recognizing the signs of a stroke and acting quickly can make a difference in recovery and lower the risk of dementia. So some of the signs of stroke can affect the ability to walk. They can cause weakness in arms or legs, slurred speech, changes in behavior such as having emotional outbursts, and impact the cognitive abilities such as memory and abstract thinking, holding conversation, and processing visual information. And I think it's in my notes later on down the road here, but it is not uncommon for people to experience strokes and not even know it. Okay. So other than stroke, some other risk factors for vascular dementia, include atrial fibrillation or AFib, diabetes, heavy alcohol or drug intake, high blood pressure, high cholesterol, being physically inactive, sleep apnea, smoking, stress, an unhealthy diet, and an unhealthy weight, okay? These can all cause or be risk factors for stroke. So here's our little image to help us kind of solidify the information. So we've got conditions such as a blood clot can disrupt the flow in the brain, okay? And some of the symptoms are forgetting current or past events, misplacing items, trouble following instructions or learning new information, hallucinations or delusions, and poor judgment. And vascular dementia is typically diagnosed over the age of 65. People with vascular dementia may experience these symptoms: difficulty performing tasks that used to be easy, such as paying bills, trouble following instructions or learning new information and routines, forgetting current or past events, misplacing items, getting lost on familiar routes, problems with language, such as finding the right word or using the wrong word, changes in sleep patterns, difficulty reading and writing, loss of interest in things or people, or apathy, changes in personality, behavior, and mood, such as depression, agitation, and anger, hallucinations or delusions, and poor judgment and loss of ability to perceive danger. So again, very similar to some of the other dementia diagnoses. There is no one specific test that can diagnose vascular dementia. If vascular dementia is suspected, your doctor will likely perform a number of physical and cognitive tests. The combination of physical and cognitive test results, along with a detailed medical history, will provide your doctor with the evidence they need to make a diagnosis, okay? What is the treatment? Well, because many different disease processes can result in different forms of vascular dementia, there may not be one treatment for all. However, vascular dementia is often managed with medications to prevent strokes and reduce the risk of additional brain damage. Some studies suggest that medications that are used to treat Alzheimer's might benefit some people with an early form of vascular dementia. Treating modifiable risk factors like high blood pressure, diabetes, high cholesterol, and problems with the rhythm of the heartbeat can help prevent additional strokes. So bottom line, living a healthy lifestyle is important to help reduce the risk factors of vascular dementia. Okay, so if you are on a fast track to hypertension, or you're overly stressed, or you have some high cholesterol, diabetes, things like that, just be mindful. Okay, vascular dementia is no respecter of persons. It can affect any and all of us at any time. Okay, so make sure you take care of yourselves. So caregiving tips. So there's many ways that you can help your family member or your friend maximize their independence and cope with the cognitive symptoms of vascular dementia. So unlike Alzheimer's disease, individuals with vascular dementia might better remember things in their daily life when repetition and context are provided. Simple cues can jog recall when remembering is difficult for them. Structured and predictable routines can also be helpful. Assistive devices and technologies such as pill boxes or electronic reminders on a phone, they might be useful as well. Breaking down complex, now overwhelming tasks into smaller and more manageable steps will make them easier to complete. Okay, so keep that in mind, where before you could just say, honey, I need you to do A, B, C, and D. Okay, well, honey might not be able to understand A, B, C, and D anymore. So you might just need to give them A. Okay. It's also useful to simplify explanations and directions as the disease progresses. Even tasks they learned years ago, like shaving or brushing their teeth, they might require step-by-step instructions. And understanding that about the disease will make your caregiving a little easier, because you know what you're getting into, you know what to expect, and you can adjust accordingly. Problems with attention can make focusing and concentrating more difficult for your family member or your loved one. So ensuring that an environment is not overly busy or noisy will make it easier to pay attention. Multitasking can be particularly difficult. Individuals with vascular dementia might have an easier time completing tasks when they focus on a single activity at a time, instead of dividing their attention between multiple tasks. Changes in mood and personality can accompany cognitive changes in vascular dementia, and often these changes are most distressing for caregivers. Approaching these behaviors with the understanding that they are the result of changes in the brain, as opposed to a choice that a healthy person would make, and they can help you guide on how best to respond and manage them. Okay, so again, understanding this is not my loved one right now, this is their disease. Doesn't make their words or behaviors hurt any less, but it can definitely help you to cope and rebound after one of those incidents. Identifying possible reasons for the behavior change. So examine the situation and determine if there is some behavioral trigger to the change. Keep in mind that the person may be less capable of expressing their distress adequately if they're experiencing pain or discomfort. Caregivers can often use the individual's behaviors as indications of distress. So if they're starting to get a little squirrely, try to figure out if they're comfortable. Are they in pain? That might just be all that they need. They might just need a readjustment. They might just need some reassurance. Consideration of safety concerns can guide your response. So many behaviors can be distressing and bothersome for caregivers. They're not necessarily a safety risk for someone with vascular dementia. Some behaviors can be potentially dangerous for the individual with vascular dementia or the caregiver. So you got to consider are we safe, or are we not safe? Disruptive but not dangerous behaviors such as repetitive questioning or pacing may respond to a softer approach, such as engaging in another activity as a distraction. Okay, so if they're being disruptive but they're not in danger, you're not in danger, try to distract them. Okay, maybe put on a song that they like, put on a program that they enjoy. If they still like to do, they like to flip around with books or color or something else. Okay. Practice patience, acceptance, and flexibility. Remember that emotional outbursts and personality changes are due to underlying brain disease, and they're not a deliberate response or reaction to you as the caregiver. Okay? So when the behavioral problems become overwhelming to the family, it's critical that you seek out support. Okay, you might understand that this is the disorder talking, or this is the disease behaving in this way. But again, assess for safety. If you're safe to handle it on your own, do so in the best way that works for you and your loved one. However, if it's too much, if it's too dangerous for you or your loved one, seek assistance in the best way that you can. Seek out support. So support groups are helpful, obviously. Can give you space to vent, to grieve, to gain advice from others who are experiencing similar challenges. Or you can explore other sources of respite, such as adult day programs. And that's beneficial for both you and the individual you're taking care of, okay? So bottom line, you don't have to do it alone, okay? There are resources out there. All right, and next we're going to talk about mixed dementias. So because different types of dementia can have different causes, it's possible for a person to have more than one type of dementia. When this happens, we call that mixed dementia. So the most common form of mixed dementia, the abnormal protein deposits associated with Alzheimer's disease, coexist with blood vessel problems linked to vascular dementia. So that's the most common mixed dementia, is Alzheimer's and vascular. Alzheimer's brain changes also often coexist with Lewy bodies. And in some cases, a person may have brain changes linked to all three conditions: Alzheimer's, vascular dementia, and Lewy bodies dementia. Researchers don't know exactly how many older adults currently diagnosed with a specific type of dementia actually have mixed dementia, but autopsies indicate that the condition may be significantly more common than previously realized, which makes sense if you think about the majority of dementias are caused by abnormal protein deposits in the brain, and wherever those proteins land is going to affect the type of dementia you have. So it does make sense that you could have more than one. Autopsy studies play a key role in shedding light on mixed dementia because scientists can't yet measure most dementia-related brain changes in living individuals. So the most informative studies, researchers correlate each participant's cognitive health and any diagnosed problems during life with analysis of the brain after death. So most of the information that we're going to get is going to happen post-mortem. So it is very difficult while you're caregiving for somebody with dementia to really know for sure what's causing their dementia. And so that's why I think it's helpful to understand the differences and to understand specific symptoms so that you can maybe talk with your doctor about specific symptoms and maybe getting a more clear diagnosis. So some experts recommend that suspecting mixed dementia whenever a person has both evidence of cardiovascular disease and dementia symptoms that get worse slowly after time. Evidence like this may indicate the presence of both Alzheimer's and vascular dementia. So again, because of its nature, it's very difficult to diagnose mixed dementia. So list the symptoms that you notice and discuss them with your doctor or qualified healthcare provider. Okay, you're there with them more than anybody else, so you will know what their symptoms are like. And so maybe just start making notes about behaviors, changes that you've noticed, and that might help guide your medical professional in getting a specific diagnosis. So depending on the symptoms experienced, someone living with mixed dementia may find relief with medications approved to treat Alzheimer's disease, as well as certain alternative treatments. So again, before starting any treatment, the Alzheimer's Society, which is where I got majority of my information, they strongly recommend checking with a doctor or qualified healthcare provider first, especially since we learned that in previous slides that some Alzheimer's medications can make symptoms worse if they don't have Alzheimer's. So it's very important that you have these conversations with your doctor. So that is the end of the information I have right now. I will stop sharing my screen. And again, for those of you who maybe jumped in later, I am open to hearing questions and comments. However, I am not a licensed medical provider. I am a social worker. So specific medical questions, I just am not qualified to answer. But I am definitely open to hearing your questions. And if I can answer them, I will. or even just hearing your comments or your insights. I'm open to hearing anything you guys have to offer.
Good morning. Great information. We hear this all the time, but the more we hear, the more I understand. I appreciate that. A question, have you heard that people that have nervous breakdowns are more prone to dementia?
I personally have not heard that, but it makes sense, especially when you think about the havoc that stress can take, or the toll it can take on our bodies. And so, especially if you think about like vascular dementia, where a lot of like hypertension and stress and things like that can definitely, what's the looking for? Can cause a lot of heart problems. And so I don't know of as far as the other dementias, but I'm just trying to connect the pieces. That would probably be the only thing. Like if you're so stressed that you're having a nervous breakdown, you probably will have some other physiological symptoms that are indicative of maybe poor vascular health. And so I would definitely, if you're having those experiences, talk with a professional about the potential of developing vascular dementia.
Yeah. One of my sisters is having some issues, and they're having her evaluated, but she started out with hallucinations and things like that. So I was just wondering, maybe she had a nervous breakdown or something, and we didn't know about.
Yeah.
But
Yeah. Well, and you know, if you've been, and I know you have, Shirley, but if you've been to any of my other trainings, you'll know that stress is one bad mofo, right? It can wreck you pretty fast. So if you're experiencing chronic stress, yeah, I would definitely wouldn't
That's
rule out
interesting.
the later development of dementia.
That's interesting. Thank you.
So if you have yet to do so, please put your email in the chat. I would love to send you a post survey to get your feedback on this presentation. Again, I know I gave you a lot of information, and I apologize for not having the credentials to dive deeper into specific questions. You know, it's not my forte. But if you do have specific questions, I would just really encourage you to reach out to your medical professionals, whoever's seeing your loved one, caring for them, and say, you know, hey, I learned about Lewy bodies, or I learned about mixed dementias, and I've noticed, you know, some symptoms that maybe think that this should be an evaluation. I just really hope the goal here was just really to give you, to empower you with education, so that you can feel more prepared, better prepared to have conversations with your doctor about specific symptomology that you are dealing with your loved one. And then also to try to give you some caregiving tips. And I think the bottom line is to just understand that some of these behaviors you're experiencing with your loved one are not intentional. They are just part of the disease. They're part of the disorder. And so hopefully that will allow you to give them grace and compassion, and also yourself.
So this can be a long process, especially with elderly people, because I mean, like you're saying, there's so many processes to go through to understand before they can do drugs and whatever. So like my mom is 93 years old. How many drugs can you experiment with to actually, because a lot of it could be age as well as the dementia.
Yes. And you know, the beginning slide, I don't know if you got it or not, but it said that a lot of dementia symptoms people do attribute to old age, but they're not necessarily normal aging behaviors. I mean, I think we all get a little forgetful, and we all get a little slower as we get older, but like the hallucinations and like the outbursts and the behavioral inappropriate behavioral things like that, I mean, that's not normal for age progression. That those are disease specific symptoms. So I would just say, just keep track of whatever you're experiencing from her. And even if you can't give her medication or that kind of treatment, maybe even just try to find some creative ways to navigate those behaviors that preserve your sanity as best as it can.
Yeah. Right. Yeah.
Yeah, I have a question.
Yes.
My mom did okay in a daycare. It appears that some daycares are kind of like full. Do you have a list of reputable daycares? Because she's so type A, likes to be in front of attention. Hard finding daycares that keep her going. The only thing that I've been able to find lately that really works is to bring her to Walmart and let her go crazy in a cart that she likes. But she likes engaging in people, and I want to get her more exposed to that so she could talk about and share with them not only life's journeys, but more someone close to her age, you know?
Yeah, yeah, and I think being around our peers is good for all of us, right? So we have a database on our website, alabamarespite.org. I'll go ahead and put that in the chat. And there are several options, and they are divided by county in the state of Alabama. I personally don't have any experience with them, but they are just the ones that we know about. And so we do always say we don't give referrals, but we can kind of point you in a direction. So do your due diligence in vetting these places to make sure that they are a good fit for you and your loved one. But that's also on our website. So maybe that can be a good starting point. Depends on where you are. Obviously, there might be more or less in your area. Some of our more rural areas have less, but many of them are faith-based organizations. So churches will often have respite programs. And then of course, there's one here, I'm not sure where you are, but in Madison County, I know there's a place called Christie Care. So there are some that are not faith-based, that they are like kind of secular. So I would just recommend going on our website and kind of digging through that database and seeing if there's anything there that is worth checking into.
Are you in the Birmingham or Huntsville area?
Huntsville. I've gone to Christie, great. And then Legacy is booked. So
there is, if you're in Huntsville, Madison County area, there is Studio 60, I believe, which is the senior center, Madison County Senior Center. They have, I believe it's daily meetups with seniors to kind of get together. They play games, they feed them. I'm not sure how much medical staff they have, if any, but it may be something worth looking into and just see what they can offer and if it meets your needs.
Thank you.
You're welcome. And I believe that's also listed in our database as well.
Yeah. Quickly, there are several here in the Birmingham area. My mom goes to a faith-based one, and I promise you, it has saved me and her.
Yeah, because our loved ones get tired of seeing us too, right? They need a break. Did anybody else have anything they wanted to add or any questions before we go? All right, so coming down the pipeline here, we do have our caregiver support group. I believe it's on the 28th or the 29th, I'm not sure. So if you haven't registered for that and you'd like to participate, please do. There's still plenty of time. We are going to be playing bingo. So I will be, the sooner you can register, the better, so I can send you out your cards, and there will be prizes. So that's kind of a fun way to end October. I'm also going to be having the Overcoming Caregiver Fear coming up as one of my educations. And then next month, I don't have a whole lot scheduled, but I do have for now a representative from Expect Care, which is palliative care, coming in to talk about their program and kind of demystifying the hospice experience. And so I really encourage you to all log in for that. It's going to be some great information, very eye-opening things that you kind of have this understanding of what hospice is. And I heard this person talk and I realized I was way off. They offer so much more than just end-of-life care that can be very helpful. So I hope you tune into that once the registration becomes available. And as always, if you want to schedule a care chat with me, you're welcome to do so. You can either email me, call me, and I will put you on the schedule just to give you some space to be heard and to be validated. I'm always open for that. And so, yeah. Thank you all for coming. I always appreciate seeing familiar faces and new ones. It's very encouraging for me to know that you're getting something out of this. So please fill out those surveys so I can keep bringing y'all what you need, and enjoy your weekend. Try to get some rest, okay?
Thank you.
Thanks.
Bye, everybody.
Bye.
Bye.